providers are now texting back and forth with their patients, which is great, especially for behavioral health. That has really exploded as conversations with their behavioral health provider. That all has to be encrypted too, which also there are platforms for. A lot of times your patient portal provider can provide something along those lines as well for the text option.
I made a huge mistake, Victoria.
You did? Not you.
We were not live. We were just talking about ourselves. I'm sorry. I just pressed the button. So we have to go back and discuss everything all over.
It popped up and said I was in the show. I had no idea.
Or we have to put this recording for our people, but I don't know.
It's up to you. Whatever you want to do.
Okay, we'll do it quickly. Happy Thanksgiving to everybody. I think probably this was a happy Thanksgiving gift to all of us, but surprise. Well, since now we are live, me and Victoria, I'm going to make one announcement that Victoria would be helping me out and she would be hosting these sessions more and more often. So far, all we did is a little chit chat about Thanksgiving. We shared our travel plans, and we are going to continue this session for another 20 minutes so that we can talk about the real solid content. Again, once more, for everybody who are listening us now, we had a lot of technical difficulties today. My camera did not work, first of all, and so I'm using my iPhone. I hope I'm sounding a little better, but Victoria's camera is working great, and she's looking beautiful, and she's looking great. So I will let Victoria speak, and Victoria, it's your time.
Thank you, Kunal. I'm super excited to be here. We did have a little technical difficulty, so I really appreciate everybody hanging in there with us. Again, as you know, if you have checked us out before, we're usually on Thursdays, but we are going to be celebrating Thanksgiving tomorrow, as I'm sure all of you are too. So we bumped it up a day. You get to see us on Wednesday. So overall today, we are going to be discussing how to remain compliant within your practice while also giving yourself that competitive edge that maybe some of your area providers don't have. Okay. So one of the biggest things that we just talked about is patient portals. They are extremely versatile for patients to be able to access their information, also provide information.
I want to tell my story again one more time. I'll tell them, how did I get my appointment with the orthopedic doctor? That was a great story. I wanted to tell the people that story. May I?
You absolutely can. It is a good story.
Fantastic. So I've been trying to reach my orthopedic doctor for my back pain, and I could not get anybody over the phone. So Victoria, I tried to find if they have a website. It was a big group, so I thought they have a website, and I went online and I was surprised. They have a great website. I was able to pass through the website, register myself as a patient, put all the history information. Even I could attach my MRI reports, and I went through it, and in the end it asked for me to pay for the copay, and it gave me the first available appointment. It showed me right there. It was a 10 minutes process, very smooth, flawless. I was able to see the doctor. They also give me an option on the patient portal itself, whether you want a telemedicine appointment or you want a doctor to see it in person, everything right very clearly. I was very impressed. Well, within 10 minutes, I get an appointment, and I was able to get their email confirmation that, hey, you don't need to come 20 minutes in advance, which is typically a response from most doctors' office when you call them. He says, well, you don't need to do that. Come, 5 minutes before, see the doctor, and you would be done in like maybe 30 minutes. I was so damn impressed. I tell you, patient portal is a real blessing for doctor's office. And every doctor office, no matter whether it's a single doctor, two doctor, how busy is the doctor? It's not about doctor. It's not about the practice. It's about the patient convenience.
Absolutely. So that very first contact that you had wasn't even with a live person, but was positive.
Yeah, it was online completely. It was great experience. And when I go to their office, they didn't have me sign up any single document. It was perfectly compliant. So I didn't need to worry about it. What will somebody do with my 20 pages of sheet, which I signed up and I have put my information on it? Nobody knows about it. I don't need to do about it. And I didn't need to fill out the form or do anything. So I was very, very happy, and I was feeling very safe that, this should be the way patients needs to be seen in any doctor's office.
Absolutely. I get really excited whenever I see or hear some of our current clients saying that they're moving that way, because it really does just provide easier access to care and less admin burden on your front desk staff. So you have the best of both worlds there. Obviously, you want to make sure that your patient portal and all of your healthcare IT remains compliant. And you had stated a great way of how you like to integrate all of that information.
Yeah, so patient portal, the biggest challenge with patient portal is most doctors, they're not IT savvy, right? So they don't understand how it is going to work. So they normally talk to their IT guy. Now, most of these IT guys, it's very easy for them to build a brand new website. And they give them all the information. They say, okay, we'll accept your payments, we'll accept your forms. And the way they accept the forms is they upload a digital copy, like a PDF copy, on their website. Well, that's not what the patient portal means. Patient portal means you enter the data in a raw format. They don't get that. So they have to, there is a difference between a PDF form you provide on your patient portal, and patient has to still print it and sign it and scan it back. No, this is not what the patient portal means. Patient portal means patient securely enters all the demographic and his history and his information securely in your portal through the keyboard and mouse right in front of the computer.
Absolutely, with the digital signatures and
all the good stuff. And once that reaches to the doctor's office, so patient portal is supposed to remove the bottleneck between a medical practice and a patient. It's about patient convenience. It's not about medical practice. It gives the convenience to medical practice because it removes the bottleneck, it removes the gatekeepers, it removes a lot of manual effort by their people in the practice, like staff. But the best thing what it does is it provides patients convenience, and it allows them to use their time wisely. Otherwise, seeing a doctor is a half a day process. If you have to see a doctor, you become nervous. I mean, you have to keep.
You're taking the whole day off.
All day off.
Right. Who wants to do that? No, I want to show up, get in, have my appointment, get out.
30 minutes and then you get out. Yes.
Everybody wants that.
Everybody wants that.
So in order to keep all this data secure, again, your vendors hopefully have already passed their own security checks. You've done your research. You have solid vendors. But you still have to overall protect yourself, your data, everybody's data. So, of course, there's the physical ways of that, locking your computer and shutting things down in off hours, all that good kind of stuff. But in your experience and with your consulting expertise, what are some of the best digital securities, like antiviruses, that would be able to protect that information even if no one is physically there at the office?
Yeah. So, data security is extremely, extremely important. And especially with HIPAA, a lot of these doctors and their staff and their nurses, they think, oh, we are just sharing the patient name. Well, even if you're sharing a patient name on email, on the social media, it is a violation of HIPAA. You cannot do that. You have to have a secure email system software in place in order to share any patient information, even if the patient name, date of birth, any kind of, even if you don't have the codes or medical information attached to them, it doesn't matter. Even the disclosing patient name itself is a HIPAA violation. You cannot do that. So it is very important for you to understand, or anybody to understand, that patient information has to be protected through HIPAA law, whether it's a medical billing company, it's a communication between a billing company and a doctor's office, it's a communication between a patient and a doctor's office through email. All information needs to transfer or exchange in a protected manner through secure email. There is no shortcut. The doctor's office has to adopt secure emails, period. Otherwise, it will be a disaster. Anybody can make a complaint. Anybody can put a practice into. So for year 2023, I suggest everybody, two things very important: this patient portal you talked about, and then security, digital security of your emails. $50 solution. Think about it, a month.
Versus an OIG fine.
That's, yeah, exactly.
Right. Those get pretty hefty when they want to go digging in.
And think about it. Patients should feel safe. It's all about the patient safety. It's all about the patient, not only the physical safety, but he should feel safe right here in his mind that, you know, my information is not disclosed without my permission to anybody from this office. If a patient comes, he sees on the reception, you always see a big glass. Those are sitting in the, on the back. But they're still exchanging patient information and notes. It makes me worried because you always have paper sitting there and anybody can see that paper. Anybody can see, like I can see other patients' information there. Other patients can also see my information there, right?
Oh yeah. I have had times where there's, you know, your staff gets busy and there's stacks on the desk, you know, or there's
what if somebody takes
that the computer is open, you know, and they're there at their computer. They didn't leave it open, but it's angled.
Yeah,
I can see that computer, and I can see that you were on your last patient before I came in. So those are the little things that I agree are just really important, making sure that we are always remaining HIPAA and high-tech compliant.
It is. It is. How do you guys see those things happening in your practice? I'm curious because we've been talking about these things for so long.
We have. So we provide a lot of resources and consulting and just overall network. We are not ourselves a compliance company, but we have a lot of great friends throughout the industry. So, you know, we're telling our providers to do vendor checks. You know, there's IT companies that will come in and check your security, where your fail safe's at, what's your contingency plan. I believe the article that I read said that 88% of providers have missed out on a holiday or a weekend event because of they had an attack during those off hours when they're the most vulnerable. So those are the type of things that we're telling our clients to start doing, because as technology advances, so does the criminal side of technology advancement. You know, and there was already over 500 data breaches this year that are being tracked.
Yeah.
So we're very, very aware, and anything that you have to suggest on top of that to be able to, you know, make it through 2023 without missing out on Thanksgiving dinner, I would be happy to hear.
I tell you, and every time Medicare launches a new fee schedule, like this year also in 2023, they have cuts, right? They're deducting about 4.5% regular cuts and then 4% equestrian amount. We discussed last time with Dr. Singh. You remember our conversation?
Yes.
And then the whole agenda behind it, that even Medicare wants you to launch new initiative in your practice to protect the patient information, to provide safety to your patients, to provide patient convenience. And it's not just clinical, but even non-clinical functions. And and practice management is a big and key component. Even the medical. I think there is one thing which I read somewhere about. I don't know. Probably you know better that how to ensure the safety of sending the drug information from medical office to a pharmacy.
Yeah, everything should be going through a secure platform now, right? So I'm sure, as you know, a lot of EHRs now have an option to be able to send to pharmacy through their secure portal. Refills can be requested through your secure patient portal. So it definitely comes down to you need these healthcare IT options to be able to stay ahead of the IT game,
right?
But also to ensure that you have your patients feeling comfortable and safe, and you don't have any worry of any violations because you tested your system and everything's fine. You have fail safes and contingency plans. Someone who is assigned to take care of these issues if something comes up, you're not around. Owners can't do everything. We pretend like we can, but sometimes we need help.
And the same mindset works in the doctor's office. Doctor thinks he can do it, things are in control, or practice management thinks that things are in control, but sometimes it fails through the gaps. And that's where the technology comes in. That's where I say use technology, because technology can fail, but you can replace it. So like my camera on the computer failed, but I use the iPhone, right?
We figured it out.
We could figure it out. And I forgot to press the button, because those are the things which happens when you are juggling a lot of things in one go. But you are right. I mean, it's a human mind, and we all tend to forget about the things.
Absolutely. So overall, all of these things on top of just being compliant, because that's always a top priority, especially for your compliance officer. I'm sure they are loving this, hearing all of these things.
Yes.
Shout out to all the compliance officers out there, because
fantastic.
We know, like, everybody complains about what you tell them to do.
Yeah.
But it needs to be done, and it's extremely important. But on top of making sure that you're compliant, following all the laws, following all the rules, following all of your contracts, payers have their own rules within the contracts of what you need to do. It's also giving you a competitive edge, because now patients have easier access to you. They have easier access to their records. If they need to go to a specialist, they can put their own records. They don't have to wait on your front staff to do that for them, who's super busy.
Right.
All of these type of things are what your shareholders want to hear. It's what your partners want to hear. Anything that just overall brings you up a step from those around you.
So would you mind, I'll ask one question. Actually, I had that question in our last credentialing, session we did, and I forgot to ask. And let's touch base to that. Because I know you are expert on credentialing. So let's say as a medical practice, we had a contract with, let's say, 70% of Medicare fee schedule for year 2018, which is 5 years ago. Now, if we want to negotiate or renegotiate that contract, what will happen? How would my reimbursement from United would be coming in 2022 or 2023? Would it still take the Medicare fee from 2018, or it will follow the Medicare fee 2022?
So typically, I say typically because every single contract is different. Typically, it is stated in the contract that it is going to follow the current year CMS fee schedule.
Most of them, right? Typically, that's your standard big payers typically say it'll be the current year CMS of your locality, all that good stuff. So if you were contracted in 2018 and 2022, you still would have been getting the 2022 rates, not the 2018 rates. Got it.
So going forward with 2023, what you have to watch for, and what you're trying to negotiate towards, is to either remove the sequestration from your contracts so that they pay you whatever percentage of the Medicare fee schedule, and that's it. If they won't do that, because some have state standards, they can't remove language, then requesting an increase to offset those decreases from the CMS fee schedule itself is going to be your next step. And say, we deserve this, and this is why. And that goes into all of those special things like having patient portals and great, IT. And if you're multilingual, have specialized services, anything along those lines, to be able to push back on the Medicare Advantage and the commercial payers who are following typically the CMS fee schedule, which, as we all know, has finalized for 2023. And so making up that gap with that decrease is going to be imperative.
So I have a client, and most of these big groups, they want to track their payer contracts into while they post payments, right? They want to track if Aetna has a 70% of current Medicare fee schedule, they want to see if Aetna is paying 70% or not. Similarly, Cigna wants, they want to create those fee schedule in the system. But when they bill Medicare itself, their charges are like twice the Medicare fees. So it never matches. They have to still adjust. They have to do the write-offs.
Right. So, and that's pretty typical, simply because of you have to charge everybody the same amount. So the majority of our clients, their usual and customary rates are 1.5 to 2 times Medicare.
Mm-hmm.
And that is to be able to encompass those payers that are going to pay possibly higher than Medicare. So potentially you convince, United to pay you 110% of Medicare fee schedule. You have to make sure that your usual and customary is higher than the Medicare, because otherwise they're going to say, well, you aren't charging that anyway. We're not going to pay you extra. You didn't ask for it. So the majority of our clients, that's how they do it. We typically do what's called a rate analysis, which is like you were speaking of what are our usual and customary versus what is our, allowed amounts from each of the individual payers. And then we're able to do a rate analysis that way and see which ones of our payers are closest to our usual and customary, which payers decided to suddenly start paying us 60% instead of 70%, so that we can call those out, because they love to do clawbacks on providers, but they don't do clawbacks on themselves. You have to tell them.
So your billing, so it's very important for credentialing department, payer department, to work with billing, especially in at least the month January and February, 2 months in year 2023. Very critical role. You guys are going to be on edge, right?
Absolutely.
And you would put the billers on that.
Lots of contracts and new payers. The new year always brings new payers. Everybody knows that they like to merge and, just eat each other. And, so Medicaid, a lot of the Medicaid payers will lose their government contract and then get picked up by somebody else. All of those good kind of things are coming in January. So if you are not fully prepared for that yet, I highly suggest reaching out to your biller and or credentialing person to see what you may need to do to prepare for your specific market.
What could medical billers do to make it smooth for them? Because everything will come on them. How can they?
Right.
Because a lot of our membership, HBMA, is all medical billers. What suggestion you have for them? How would you suggest them to handle this at their side?
I would say doing a rate analysis, like we just spoke of, with what your usual and customary is, and then what each of the payers are doing or paying out for your codes, is a great first step, because that is going to allow your client to be able to see what payers are worth negotiating, what payers aren't. Are we getting paid adequately? That's the number one thing for billers, is you are managing their revenue. This is their turkey dinner.
So they have
on the line.
Here it goes. They have to start working right as soon as the Medicare fee schedule announces, right? Their job starts now. So whatever, like top 5, top 6 payers, codes, reimbursement codes they have to start working on them. And whoever is their top 5 payers, they have to actually change the fee schedule in the system, right? Practice management system.
Correct. So that's the other thing, is gathering all of those fee schedules and making sure that you know what is what, so that you can make adjustments as needed. So if your usual and customary needs to be adjusted, then that's going to fall in line with everything else. Or 2023 comes, now you have to do a new rate analysis. Everybody's paying different. What are they paying us now versus in 2022? And again, that comes back to helping the credentialing department, which, obviously works very hand in hand with the billing department. We heavily, heavily rely on our billers to be able to tell us when something seems wrong, when there's a red flag, when we're not getting paid what we should be getting paid. All of those type of things get red flagged by our billers. I'm not going to find that out here in credentialing unless I get an actual notice from a payer, which is very, very rare.
So it's basically billers has to take initiative. And first, they have to load Medicare fee schedule from January 1st. And then they have to reach out to top 3 or 4 other payers from the medical practice and then check their existing rate schedule. Now, would it work from date of service? I'm guessing that most of the claims from date of service, January 1st, will start triggering in the new fee schedule, right?
Correct. Yeah, it's always going to go off of date of service. So if you have a December date of service, but it wasn't processed until January, it's going to follow the 2022 schedule.
That's how most all billing companies are settled, right?
Yes, I have never seen it be different. Now, of course, there'll probably be somebody in the comments that tells me I'm wrong, but I have never seen it be any other way.
Yeah. Well, I think we did our part today, 26 minutes, 30 minutes of our session. Actually, we went a little ahead, but our previous session was not recorded, which was our good and great conversation. So happy Thanksgiving to everybody again. Have a great time with your family. Have a great time going out, travel, stay safe. And me and Victoria would continue to see you more often here. Victoria, it's your closing statements.
I really appreciate everyone that tuned in today. And again, that hung out and hung in there with us while we were handling our technical difficulties. I hope you all have a wonderful Thanksgiving. Hopefully you get Friday off too. I will be shopping. And again, a great thanks to my good friend Kunal, because he introduced me to these HBMA lives. And again, HBMA is just an absolutely great organization with great contacts and resources. Until next time, have a great day.